Hi, I'm Dr. Rudy Kachmann. Welcome to our show. This, again, like we've been having on these wellness shows, how to stop, prevent, and reverse type 2 diabetes. And it's 50 to 70 diseases that are associated with it. They can be totally prevented. So when they say, you know, one of the biggest causes of death is heart attacks, but I'll be honest with you, it's actually diabetes type 2 because it's what causes vascular disease in 70 other illnesses. For example, increased rates of cancer and strokes, and 50% of dementia is due to diabetes. I'll tell you that story in a little bit. Let's go over a little bit of, so you fully understand. Type 1 diabetes is where you don't make insulin, the pancreas died. It is more commonly seen in children where virus bacteria attacks it. But I tell you where you see it also in people who have gluten intolerance, even in children, or gluten sensitivity, diabetes associated with that, that, for example, and something else which hardly anybody knows, but I can tell you the book to read to confirm what I'm saying: drinking of cow's milk. Yeah, read a book called Whitewash by Joe Keon, full of scientific papers. Hardly ever meet a pediatrician who ever, or any doctor, frankly, ever read that darn thing. It's been around for years. I've read it 3 times now, given away many copies free. The casein in milk is very carcinogenic. That's even in Colin Campbell's book, The China Study, for example. Most of us don't have the enzyme to digest milk. Asians don't have it. Only 25% of blacks have it. Only half of whites have it. And at age 4, it's kind of phased out. Most of us have intolerance to milk. So what I suggest, don't drink any cow's milk. Maybe if you need a little in your coffee, a little almond milk or soy milk or something. But we basically don't need it. A lot of type 1 diabetes and cancers are attached to milk. Hardly anybody knows that, not taught at medical school level as far as I know. But a lot of type 2 diabetics become type 1 eventually. And I tell you the reason is that it is insulin's job to push sugar into the cell for energy. Without energy, we'd be dead. Each cell is on its receptors. See the wiggling hand? Those are our receptors. Candace Pert, 1972, discovered them looking through an electron microscope. She saw cells had little fibers on them called receptors, and they're wiggling, and that's how chemicals work. Insulin will take sugar and open the door to the cell to make energy. And what happens is that as if we gain some weight, some people are thin and still do it, but it can be seen in children, for example, is that it will take more insulin to get the sugar to the cell for energy. And the sugar level may be normal for a long time. But if you test it for serum insulin, it would be elevated. That, to me, is a big mistake, that when we're screening people at a very early age, we should start pulling serum insulins. Then we would catch you in early pre-diabetes or diabetes, like if you took the HbA1c, that's your blood sugar for 3 months, HbA1c, 5.6 to 6.4 is pre-diabetes. Externally, you may show nothing, okay? But the complications of diabetes can occur in pre-diabetes. Yep. Let me just review some of the main ones, because you could avoid those. That's the good news, and I'm going to tell it to you, is dementia. You know, you hear Alzheimer's disease is not avoidable, and all the drug companies are spending money to develop the magical drug. Each time you see something like this, New York Times has a great article, you know, they don't have the answers. It would, 2 of the companies that spent $1 billion doing the research, they gave up. They threw in the towel. And I think Eli Lilly may have too, I'm not sure. but they're not coming up with a measure. It's never going to happen because 60% of dementia is due to type 2 diabetes. Now, I tell you the scientific reason. I have the scientific proof. You can read a number of books, one by Berson, another one by Dean and Ashide is their name. Great books on Alzheimer's Solution is the last book. It's right in there. Our body makes IDE enzyme, insulin degrading enzyme. When we're diabetic or pre-diabetic, our insulin levels are elevated, say in the brain, okay? We need sugar to make the brain cells work. And the ID enzyme is supposed to degrade insulin to get out of the body once it's used, okay? Well, when you have an elevated insulin level, like in pre-diabetes or diabetes, the IDE enzyme is totally used up to degrade and get rid of insulin, okay? But guess what? IDE is also supposed to get rid of amyloid out of your brain. That's the cause of Alzheimer's disease, the amyloid and the tau. Well, the IDE is totally used up trying to degrade insulin. There's none left. So there's too much amyloid. We get Alzheimer's disease. Yeah, that's in these books. It's scientific, nothing that I made up. So if you can avoid type 2 diabetes, prevent it, stop it, reverse it, your odds of dementia go way down. So when you see the Alzheimer's Solution constantly, wanting to raise money for their association for research that so far has not been very helpful, and they could get rid of half of the disease by meeting your diabetes, I say shame on them. They should be leading the fight to get rid of type 2 diabetes because they get rid of probably 75% of their problem. Let them give money to research. I'm for it. But if you can get rid of 50, 70% of it by proper diet, nutrition, and exercise, I think that should be on top of the list. Okay, let's go down the line. Other things: dementia, strokes, heart attacks, thyroid diseases, skin diseases. The biggest cause for need for liver transplants, renal transplants, and amputations. The wounds don't heal. Guess what's coming up the line? Amputated toes. What's coming up the line? Amputate the ankles, and then as we walk up the leg, a lot of them lose their proprioception, so they develop Charcot joints. They're walking on their feet like this. Can you imagine walking with your foot down like that? Give it a try. It's extremely painful. Extremely painful. Neuropathy, all caused from diabetes, the majority of which is preventable, stoppable, reversible. It's not just I who am talking. Last week in town actually was Dr. Joe Furman, who I've known for years. I've attended his conferences. He gave a conference on Saturday at the First Assembly Church. 300 people were there. To me, that's the number one way. There are other ways that are similar, and I reviewed some of the other books, so I don't want you to think it's just me, okay? I'm full of science, and it's a shame. It's a shame that the medical profession is not leading the fight to tell you you can get rid of diabetes. I see most people with type 2 diabetes, they don't even know it. This morning, I see people for free, incidentally, at the Three Rivers Pharmacy, owned by Sheila Walker. She owns the whole pharmacy. She's given me a free office there. I see people every Friday morning, counsel them how to get rid of their diabetes. I saw some today. And it's very inspiring to me because they're paying attention. Dana Groves from Warsaw, you can catch her on Facebook, Kachmann. You see Dana on there a lot. She's lost 50 pounds. Her pre-diabetes has gone away. And I give a talk there, like next Saturday, 11 o'clock. I give a talk there. Not tomorrow, a week later, 11 o'clock in the building next to the hospital. And you can get online for the correct address. And a book written here by Dr. Joe Furman. Remember, he gave a talk here last week. This book's been out for a long time. I reviewed it for him after he wrote it. I didn't write it. I reviewed it. So in the back, you even see my name on there. It was a New York Times bestseller list, 2.5 years. So we're coming from science, and it's been reviewed by many people. And another great book to read is by Dr. Wes Youngberg, because I want you to do some other reading, not just me. Don't think it's just me. All the scientific papers are in there, and I actually give you many other books. Mark Hyman's book, for example, McDougall, Esseltine. All these people confirm exactly what I'm talking about. It's quite scientific. And what's beautiful about this, it's really not that hard. So number one is get proper blood testing, okay? And remember I spoke about the serum insulin being elevated before the sugar. One of the best tests for diabetes is belly measurement. Yes. If your belly is bigger than your hips, especially in women, you're probably pre-diabetic, okay? Yeah. When they teach metabolic syndrome leads to diabetes, and they'll have on their belly measurement as one of the 5 factors, which can be a low HDL, high LDL, belly measurement, and CRP. They'll use for metabolic syndrome. That's a path to diabetes. But to me, serum insulin will lead the way. You got to tell your doctor, I'm going to have that. He will not bring it up. You'll have to say that, and if you got to pay for that yourself, fine. Go to a lab. Okay, a hospital might be more expensive. Go to a lab, and they'll run a glucose tolerance test on you, and they get a fasting blood sugar, serum insulin, 1 hour fasting blood sugar, serum insulin, 2 hour fasting blood sugar, serum insulin, and you can catch yourself on the path there, and then you may only need to lose 8 to 10% of your body weight, and your diabetes is gone. How fast? Less than a month. Why? Why so quick? Now, I tell you, the reason is, and Mark Hyman has it in his books too, and a DVD of his that I have, has it also. Your blood sugars will drop if you eat 70 to 80% vegetables, maybe 20% meat at most, take a walk every day. It will quick matter of days. And the reason is that the metabolism of your body is run by your biome, the trillions of bacteria that run your gut. They determine the metabolism of your body. Yes, they do. You are what your biome is. And those trillions of bacteria, you know how long one bacteria lives, Stanley? 20 minutes. 20 minutes. So in about 2 or 3 days, your sugars will drop. So if you're on a lot of medication, I would check my blood more often if you're diabetic. And if you're on a lot of medications, you got to tell your doctor, I'm eating differently. My blood sugars are going to drop, Dr. Kachmann says, or Dr. Hyman says. And a great one to read is Mark Hyman, How to Speak to Your Doctor, 70 pages, free. You can print off the internet. He has it right in there, the system I'm talking about. We're diagnosing, he puts diabetes at 5 stages. We're catching people at stage 4. What's the next stage? Amputations, dementia, strokes. Yeah, we could be catching you at step 1, where the serum is elevated and your blood sugar is still normal. That's the test I was talking about. Then we caught you at stage 1. You lose a little bit of weight, walk a little more, maybe take up tap dancing like I do. Okay, it's true. And you can catch it very early. This should be type 2 diabetes. It's an epidemic. 1 out of 2 people is pre-diabetic or diabetic, yeah. 1 out of 2. There are what's called the tophies, thin on the outside, fat on the inside. They look thin, but their blood work is abnormal. So even if you're looking great, you are what your biome is or your blood work is. A little tougher to test the biome. We could do it, but it's tougher by checking your stool. But it's a lot easier to check your blood work. Okay, so what a good blood test. That's the glucose tolerance test we talked about. Fasting, 1 hour, 2 hour, okay? The other way, and I think it's very important to get blood testing done yearly. None of this every 5 years. Well, we'll see in 2 years. Baloney to that. Spend a little bit of money, get your blood tested. I do every year. And that's very important because you catch yourself on the path to diabetes. Remember I said all the complications of type 2 diabetes, which I talked about, can occur of pre-diabetes, a significant number is unannounced heart attacks. No warning, no angina, yeah, especially women. Just grab their chest and they're dead. Say with an HbA1c around 8 or 9, pre-diabetic. Yeah, pre-diabetic, but no external symptoms, no warning. Mm-hmm. Most common, half the people that die from heart disease, that die from it, half have no previous symptoms. Mm-hmm. And angina, a warning that something's going on with the heart, is different in women and men. Yeah, in men, you know, it's left arm, left jaw, sternal pain, usually. In a woman, it can be on the right. Yeah, it can be in the axilla. Any pain between the pubis and the ears in a woman, say with a little bit of nausea, vomiting, could be a heart attack. Absolutely. I've seen it. I've read it. I spoke to a cardiologist the other day when I was playing pickleball, and he was a cardiologist from another hospital. He said, "You're right, Rudy, because I saw a lady recently, her pain was right here." Even as a neurosurgeon, I remember seeing a lady was overweight, 40 years old, maybe seeing me with right arm pain, severe. Her MRI even showed some disc disease and arthritis, and I was, you know, going to treat it conservatively, maybe operate down the line while she's walking out of my office to her car, fell down, had a heart attack. She survived, fortunately. But that goes to show you that any pain on the right in a woman, doesn't feel right, feel tired out, I'm exhausted, don't play with it. Consider that they're having heart disease. And of course, especially if you get a weight problem, you're eligible for increased rates of breast cancer. If you get increased fat on you, there's more estrogen in you, and that's what causes breast cancer. So in losing weight, you can get rid of prevent, stop, reverse your type 2 diabetes, but you can also avoid a lot of cancer. You can avoid a lot of dementia, even at a younger age. So to throw in the towel on people who have some memory loss is a mistake. Things can be done about it, but there's very little knowledge about it, so unless you're doing some reading and literally educate your doctor, it very well could be missed. I actually read a book by Peter Whitehouse 15 years ago, called The Myth of Alzheimer's Disease. He did the research on Aricept, the drug. He said it don't work. And we're causing a lot of people to live into the role. You missed a few words, and well, you got Alzheimer's disease, and they put you in a nursing home in a unit that says Alzheimer's disease, and you start living accordingly instead of eating right, exercising right, and getting rid of your type 2 diabetes, which may be causing it. Remember we spoke about the IDE enzyme in that book I referred to recently, the most recent one. I like Bredeson's book, and I like Alzheimer's Solutions is the name of the last book by Dean and Ashide. They are from Afghanistan originally. They were there 3 years from NIH, he was. And I'm going to visit them in California soon. And they mentioned to me that Los Angeles is close to where they live in Loma Linda, and found that they have a hard time finding someone over age 65 who doesn't have memory problems. And yeah, it's true, because they're diabetic. Certain ethnic and racial groups have much higher rates of type 2 diabetes, and part of that is, for example, it doesn't matter whether white or black, the slaves were not given food. So they ate sugar cane to supplement starvation. No breakfast, no lunch. This happened. I read it in the book, and I saw pictures of them, which changed their genetic structure so they're much more sensitive to sugar. For blacks, for example, they could have been white, but they happen to be blacks. They have genetic changes. They're sugar sensitive. Yeah, I went to a funeral recently where the gentleman that died had both legs amputated. Another brother had a leg amputated. Mother had diabetes. So they say, oh, it's genetic. It's in your genes, all right, but it's the food you eat. It wasn't their genes. They ate right, and that wouldn't have happened. So it is what I'm trying to do is educate you and help spread the word, because industry, because of lobbying money, will not do it. Yeah. The government supports the price of sugar and corn and fructose corn syrup. Government lobbyists give our congressmen lots of money. They are not going to change. You got to lead the way. I help you lead the way. And you got to gather some information. You got to learn to read a little bit, okay? So the books are held up for you, including Mark Hyman's work, Esseltine's work. For example, Esseltine from the Cleveland Clinic, he was here recently also, incidentally, at the Grand Wayne Center. I sat at his table, and his son Rick Esseltine has written books also. And you know what I heard him say? I heard him say, heart disease is nothing but a paper tiger. Heart disease is nothing but a paper tiger. It need not exist 90% of the time. Wow! That's been known for years. But yet, I speak to two cardiologists who recently graduated from IU, and, you know, I talk to people. So I asked them what they knew about Dean Ornish and Furman. Never heard of them. Wes Youngberg, never heard of them. Never heard of Esseltine. Yeah. I brought it up to the dean of the med school. He didn't shake his head. He just stared at me. So I don't know what to say. Industry has been captured. That's the best I can make of it. Maybe it's lack of knowledge. Maybe it's lack of knowledge. I don't know, but I refuse to sit down about it when I teach you. Incidentally, at Lutheran Hospital, and I have to thank Lutheran Hospital, I give lectures once a month free on wellness. Attend those for free. They're on Facebook, Kachmann Health. You can see the dates. I gave on there recently. The one I recently gave, this is the PowerPoint, Live to be 100. When I give my talk in Warsaw, 11 o'clock next Saturday, not this tomorrow, the following one, I'll be handing out the PowerPoint, about 40 PowerPoints for free to the public, and which goes in more detail to Live to be 100, the type of eating, but that same thing that would get rid of your diabetes, that would turn around the vascular disease, maybe you have a better future. It can be done. Don't just accept the pill to the ill. Some pills are necessary. I didn't tell you to stop taking them, okay? But once you gain some knowledge, you may decide, you know, I'm eating right, I'm taking a walk every day, dancing or taking tap dance lessons or whatever you do. Do the exercise that you enjoy. It could be dancing in place, or a walk, or taking the dog for a walk twice a day, for example. Exercise is about 20% of it. 80% is the type of food that you're eating. So it's simple. You eat the right type of food. Remember I spoke about your biome changing a matter of days? You could get rid of type 2 diabetes 90% of the time, 30 days or less. Yeah. And check your blood sugar more frequently, and talk to your doctor about the medications, especially insulin. Hyman has in his books many times insulin. He describes it in the 70 pages you can get free off the internet. He describes it. Most people get rid of their insulin in about 2 weeks. Why the changes so quickly? I already told you the reason. Your biome, those bacteria, the lifespan is very short. So the changes very rapidly. And the insulin level will go down. Insulin does more than put sugar in the cell. It makes your arteries stiff. It causes dementia. It causes arthritis, increased rates of cancer, increased rates of thyroid disease. So if you can get your insulin level down, even a type 1 diabetic, you know, they may have insulin pumps and things, and I saw a boy recently who looked like he was way overweight. He's type 1 diabetic, had an insulin pump. So his mom was telling me, he eats anything he wants to, and he just puts some more insulin into his pump to get the sugar down. You know what the trouble is? is because the insulin level is up, it causes a lot of the other side effects. Insulin is anabolic. If you take insulin, it makes you gain fat. That's anabolic. You think it's going to make things better? No. And you look very unhealthy. He could be living on 10 units of insulin a day, but because he eats a bad diet, way of eating, let's say this way, he's not healthy. He'll probably die in his 40s and 50s. The type 1 diabetic, if they take care of themselves, they only need 10, 15 units of insulin. I didn't say the number, whatever you need. They eat right. I know a doctor that did it, a pediatrician. He lived to be 103. You may have a normal lifespan as a type 1 diabetic, but if you don't eat right, the lifespan is, 40s, 50s, sometimes even less, because insulin does more. I mean, it saved a lot of kids' lives. Before that, they died. Before Banting and Best discovered insulin in 1920. And what's interesting about that story, you know what the diet that was recommended before they discovered insulin in 1920 is a high-fat diet. Yeah, high-fat, low-carbohydrate, because they didn't have any insulin. Okay, that worked real good. Then Banting and Best came up with insulin, and the diabetic clinic at Harvard actually they switched to a low-fat diet, and it didn't work. It took them 20 years to figure it out. Yeah, it didn't work because they ate the wrong food. Yeah. Finally, their clinic, I think it's called the Banting Clinic or something like that, now has changed again, but they really get behind the times, so it's sugar is the booger and the hooker. Okay, that's the bad guy. I mean, there are bad fats, there are good fats, but fats from plants, nuts, guacamole, are healthy fats. Fats from plants are the omega-3, the good fats. It's the bad fats from animal meat that are not healthy. So in summary, let's summarize our thought process here. The good news, you can get rid of type 2 diabetes 90% of the time, probably a month or so. Check with your doctor, let them know you're eating differently, and check your blood sugar more often, and don't stop any medication until it's okayed by your doctor. But if your sugars, and know the symptoms of low blood sugar and high blood sugar, okay? You can pick them up on the internet or in books. You got to know those because, like I said, the sugars, because of the biome and the quick changes, may drop pretty quickly. But if you can get rid of the issue, you probably added 20 years to your life. Avoided maybe 25 years of disability, amputations, heart attacks, strokes, nursing home, dementia units, all can be avoided. Yeah, and I mean what I say, and I get the literature to back it up. That's the reason I'm here today to tell you this, because I care about you. I care about you. I love you. And if you need some coaching, you can't seem to do it, go to the Three Rivers Pharmacy, call Sheila Walker, 373-1083. She'll give you an appointment to see me for free. I'll enjoy doing it. And I'll show you how to educate you and follow you, see you monthly for free to get rid of this epidemic and plague that's upon us. And thanks very much for watching. Namaste. Why do I do this? Physician means doctor, and I love you. Thank you. Bye-bye.